was quite shocking for us is that 11% of respondents did say that they were experiencing thoughts of harming themselves.
From mental health to physical health, a new report reveals that the COVID-19 pandemic is taking a devastating toll on Alberta women.
Women have shared with us the stress overloads that they're under and the pressures of managing a home and having the lion's share of the burden of caring for children, being their children's educators when children were out of the school system, caring for elderly parents and other relatives, and sharing the greatest burdens of taking care of the home.
In a survey of over 1,200 women, the Alberta Women's Health Foundation says 63% said stress affected their physical health, while during the pandemic, 8% had been diagnosed with a mental disorder and 11% had experienced thoughts of self-harm.
Change makers and policy makers to really consider how the needs of women need to be at the forefront as we recover from this pandemic.
Their care has also been put off in several ways, like missed appointments.
Almost 42,000 mammograms were suspended throughout the pandemic, and certainly 60,000 pap smears for cervical cancer were also postponed. Like, that's a lot, and that's in a relatively short time frame. That's within about 3 to 4 months.
Rutherford says the recent child care agreement between the province and the feds is good news for women and their health.
That is a plan that probably should not wait too long to roll into existence. This is not something that should take 3 to 5 years to bring to fruition. Women in Alberta need this now.
But it's not just Alberta women suffering. It is Canadian women on a whole. In the 2020 Hologic Gallup Global Women's Health Ranking, Canada sat 43rd behind even the U.S. and Australia. Rutherford knows that experiences for Indigenous women and women of color means that they are facing other barriers not captured by this report.
Our report didn't specifically look into this, but it needs to happen. And so that's probably a next project.
And hopes that research into the health of women, including medical trials, grows, leading to better health care of all moving forward. In Calgary, Tara Overholt, City News.